artery going to the kidney. I have bubble above it, below it. Can stents be used for that?
Do you want me to? Okay. The question is regards to a prior repair of an aneurysm with a bubble or an aneurysm above and one below. And the answer is it depends. Those can be very complicated issues, and each case is truly unique to itself. I think I told you or someone, I'm sorry, earlier that just 2 weeks ago we had repaired an aneurysm with a stent graft by deploying it within an old graft that had been repaired. The patient had developed a bubble below it, if you will, a large iliac aneurysm, and had a tube or a straight graft for repair of a aneurysm below the kidney arteries. And we actually were able to place a stent graft from within the old graft and sealed off the bubble below it. In terms of the bubbles above it or aneurysms above it, it really depends. One of the issues is that most of the grafts that were sewn in years past, that we still do here and there, those grafts were sewn in very close to the kidney arteries. So above it, below it, may or may not be amenable to a stent graft approach because of the need to preserve the kidney arteries. So that would have to be looked at carefully, and usually a CAT scan will help us answer that question. Yes, anyone?
If a person has had another aneurysm repaired, and he has a new aneurysm, is there any reason, if it's not that large, that he couldn't have a stent?
Okay. The answer is stent repair of another aneurysm after repair is a possibility. But again, each case has to be looked at on an individual basis. And it really isn't so much the size. The size really dictates whether we should do something at all. Okay? If it's a small aneurysm, your doctors may opt to just watch it. If it's big enough that it needs to be repaired.
Thank you for coming. Please try to fill out your evaluations. It would really be appreciated. We're in the process of formulating our community lecture series for the coming year, so if you have any particular topics you would like to see presented, please write them down. Thank you.